Ministry of Health of Ukraine. Krok 2. Medicine. Year 2020, number 020. A 12-year-old girl after a case of respiratory infection developed dyspnea at rest, paleness of skin. Heart rate is 110 per minute. BP is 90/55 of a millimeter Hg. Heart sounds are muffled. Borders of relative heart. Dullness. Right, the parasternal line, upper, the E-rib, left 1, 0 cm outwards from the midclavicular line. Make the provisional diagnosis. A. Somatoform autonomic dysfunction. B. Infectious myocarditis. C. Functional cardiopathy. D. Hypertrophic cardiomyopathy. E. Exudative pericarditis. Classic physical findings in cardiac tamponade included in Beck's triad: hypotension, jugular venous distension, muffled heart sounds. Kussmaul's sign is a paradoxical rise in jugular venous pressure, JVP, on inspiration, or a failure in the appropriate fall of the JVP with inspiration. Ordinarily the JVP falls with inspiration due to reduced pressure in the expanding thoracic cavity and the increased volume afforded to right ventricular expansion during diastole. It suggests impaired filling of the right ventricle due to a poorly compliant myocardium or pericardium. This impaired filling causes the increased blood flow to back up into the venous system, causing the jugular vein distension, and is seen clinically in the internal jugular veins becoming more readily visible. Disease associated with Kussmaul's sign. Some forms of heart disease: constrictive pericarditis, restrictive cardiomyopathy, pericardial effusion, cardiac tamponade, cardiac tumors limited, right ventricular filling due to right heart dysfunction, right ventricular infarction, right heart failure, tricuspid stenosis, pulmonary embolism. Myocarditis can be caused after respiratory or gastrointestinal tract viral infection. Fulminant. Myocarditis is characterized by profound left ventricular dysfunction and cardiogenic shock, which requires inotropic support. In some cases, pericardial effusions may result in cardiac tamponade. Symptoms of myocarditis: chest pain, fatigue, arrhythmia, diarrhea, headache, fever, muscle aches, sore throat, shortness of breath, swelling in legs. Offending agents of myocarditis: infectious causes, viruses, most common, enteroviruses, genus including Coxsackie virus, strain, parvovirus B19, human herpesvirus 6, HHV6, bacteria, fungi, protozoa, Helminth's non-infectious causes, autoimmune disorders, systemic lupus erythematosus, SLE, Wegener's granulomatosis, giant cell arteritis. Etiology of myocarditis: 1. Direct damage by the offending agent. 2. Secondary immune response, triggered by the offending agent. 3. Expression of cytokines in the myocardium which lead to an inflammatory process. 4. Premature or aberrant induction of apoptosis. The answer is B. Infectious myocarditis.